So a very good morning from Geneva, good evening, good afternoon, good morning, wherever you are, and welcome to this third module on geo-enabling the health information system. This series is hosted by the UNICEF East Asia Pacific Regional Office and Moru Tropical Health Network with support from TechNet 21. So we'd be happy to know who is with us today. So you can already introduce yourselves in the chat box. I see we already have some people from Ethiopia, Myanmar, and Nigeria. Nigeria is very early there, so good, very good morning. You can also use the chat box if you have any technical issue, and Ise and myself will do our best to help you in case you have any technical problem. If you have any question during this presentation, please use the Q&A box. It's available at the bottom of your Zoom window. You can ask your questions at any time, and the questions will be answered as soon as possible. Finally, this session is recorded as usual. We'll share with you the links to the video as well as the slides by email, and we'll also share the links to the materials from the previous sessions or modules. I hope you'll enjoy this session, and I'll give the floor to Ridwan. Ridwan, the floor is yours.
Thanks, Alex. Again, welcome everybody to our third training of this geo-enabling health information system modules. I hope everyone is still in spirit to complete this module. As you might aware that this is 6 modules. We have 2 hours in each, and hopefully I think everybody is already pick up to learn something from the first 2 modules. Again, I think just a review that our training is to basically to demonstrate the potential of the geospatial data and technology in public health, and also introduce the health information system geo-enabling framework and also its implementation in countries, and also provide knowledge on that. Expertise and resources that allow you as a participant to implement the learning from this module in your respective country, of course. Again, just to remind, I think it's also there, this is not GIS training, and of course, don't forget that we will also provide the certificate of completions based on attendance. We're also monitoring the attendance of people following live. It's also recording, and also a few tasks as well from our dear trainers, Steve. Just a brief update that we are gladly let you know that we have more than 500 people registered for this training. Of course, again, there are a few people following it not lively, because we also provide recordings. Half of the participants from our region, Asia Pacific region, and I think we also gladly that over around 158 in first series, and then 128 in the second series, following it lively. I know it's not easy to follow lively because of considering the time. For example, our colleagues from Nigeria, it will be early morning for you, but I'm really happy that everyone's joining this. I know this is very important modules, and also hopefully bring offer and opportunities to contribute to overall system strengthening, health system strengthening. So without further ado, I'll hand it over to our colleagues, Steve. Steve, go ahead for you. Thank you.
Thank you, Ridwan, and welcome again to this third module of this regional training workshop. Like for each module, a few slides before we move to today's agenda. The first one, to remind you that the training workshop material, not only the slides, but also the documents that I will be referring to, are accessible from the Google Drive, for which you have the QR code and URL. Ise is going to put the URL in the chat also in a few seconds. Here we go. The slides for the first 3 modules have already been uploaded, so we included the one from today. And each time you see the Google Drive logo, you will know that the document in question is in the Drive. What you have here and in the chat is also the link, once again, to the glossary of terms we are using during this training workshop. You can consult it in case you need better understanding on some of the terms that I will be using. And lastly, I have included here also the link to the recording of the first 2 modules in case you are catching up. I mean, some of you, a bunch of you have registered between the 2nd and the 3rd module, which is great. So if you want to catch up and have a look at what happened during module 1 and 2, you can also do that. Alexandre already mentioned about the Q&A, so I'm not going to come back to this. So please don't hesitate to use it if you have any question. What we have also set up is a short Google form for those who would feel more comfortable asking their questions privately, think about something between modules, right? So you have the URL here for that Google form, also in the chat. And we will try to answer as many questions as possible, either during the module itself or those captured in the Google form will be answered individually by email between the modules. This is what I have done already for most of the questions, except one for which I did not yet have an answer. That happens. And so Ise will post in the chat the question from the colleague in Sri Lanka in case one of you have an answer or know some material that could help answering this very good question, very technical one. So please don't hesitate to help the colleague by putting your answer in the chat, and we'll capture that if the person is not online today, and we'll make sure to forward the answer to this person. Finally, the chat, once again, can also be used not only for us to share information with you guys, but also for you to share resources or experience that you see relevant to the participants, right? So please feel free to use it. If you want to share anything, some project you're working on, some publications you have done in relation to the topic we are discussing, just please feel free to indicate that in the chat. A quick recap of module 2. What we did last time was to start by looking at how the HIS geo-enabling framework is being implemented in countries. More specifically, we went through the different steps of the process that is being followed when you aim at geo-enabling the health information system or a program or an intervention. You might remember that the process is a bit different depending on which one you are actually geo-enabling, and that we decided to use the process, the longer process, which is the one we apply for a program or an intervention as the reference for this training workshop, which is the process you have here on the left, which is a process that contains 2 more steps than the one we use generally when we look at geo-enabling the health information system. So that's the first thing we look at during this module. We then went through the answers we received for the first 2 questions of the HIS Geo-enablement level assessment questionnaire that we received from MOH representative from Asia Pacific. Answers that served as a concrete example of the first step of the process, right, which aims at identifying the actual priorities, challenges, needs, and gaps of the program or intervention. The conclusion of the exercise was that geospatial data and technologies can help address all the priorities that were listed, as well as challenges, and of course to a different degree depending on which priority of challenge. And the last thing we did during the second module was to go through the first task in the second step of the process, which consists in understanding the geography of the program or intervention, right? So identifying what are the geographic features that constitute the geography of the program or intervention, looking at how they connect to each other in the context of hierarchies, etc., etc. So all of these brings us to today's module of the Geo-enabling the Health Information System programs or interventions training workshop for Asia Pacific and beyond. What we can mention is actually 520 registered from 88 countries from the 5 continents. So we are really having a global coverage in the context of this training. The agenda for today's module is going to be focusing on first presenting the result of the homework we gave last time. Was only a limited number of registered participants, but we have enough contributions so that the exercise is still interesting. We will then continue the rest of the module. We'll focus on the process that leads to identifying the purpose, audience, content, and format of the final product. What kind of GIS-based products you can basically come up with through the application of geospatial data and technologies, as well as identifying the equipment in terms of hardware and software, as well as technical expertise that is needed to generate these products. The last session today will take us through, first of all, will take us through the next step in the process, which is to assess the current level of geo-enablement of the health information system, program or intervention. And the last session will cover the result of the second part of the questionnaire, right, of the geo-enablement level across countries in Asia and Pacific, which will allow us to have an idea of where the country stands across the 9 elements of the HIS geo-enabling framework. So I'll try to cover everything in 2 hours. Please bear with me in case we end up going a bit beyond this, especially depending on the questions you might have, but just please don't hesitate to ask any questions or share, again, experience or material that you see of interest. So let's start by having a look at the result of the exercise provided at the end of module 2, and which had for objective to identify the geographic features core to different health programs. I want to start by thanking those who contributed to the exercise. Again, not too many, but we have some interesting results, as luckily we covered input from 10 different countries. So thank you very much for that. Just a reminder about what we mean by geographic feature, which are naturally or artificially created features on the surface of the planet, right? So we're talking about a house, a building, a different kind of building, a road. So this will be man-made, so artificially created, a river, a mountain, etc. I mean, all what creates the environment in which we are living and which we are converting into objects when we look at this geography using geospatial data and technologies. So we also, you might remember during the last module, we look at this classification here, which makes the difference between fixed features, mobile features, and continuous features. Which is based on the different ways we are actually representing these type of features in a geographic information system. And we'll come back to this in a short while, because we use that as part of the exercise. Also, to describe to you the approach that we are generally using to identify these geographic features, which is during a workshop, right? So it's a group exercise. It's interesting when it groups representative from more than one program, right? So representatives from across the whole health system. Here in the example for which you have the pictures here, it was even more than going for one program. It was also covering 11 different countries, so similar to what we have been trying to reproduce here virtually, right? So we use Post-it to do that, and a board, and people are basically indicating on this Post-it the geographic features they are thinking about, which gives us something like this, organized by program. And then we are then reorganizing these features according to the type of features that they represent. So we did something similar here, and what we did use is a virtual whiteboard in this case, because we're all connected online. You also used Post-it, in which the participant indicated the geographic features, for example, province, if it was a fixed, mobile, or continuous type of feature, and indicated also the name of the country from where they contributed this. And so this is what we got. It's a screenshot of the result of the organization of the different Post-it according to different programs. And what I have done is to group, again, these geographic features that you have identified according to their type, right? And we will have a look now at the result here. You can have access to the result also as part of a PDF that is uploaded in the basically Google Drive. So here is the PDF you will find. We will have the link in the chat also if you want. Yeah, thank you, Ise. So what you have here in this PDF, so at the top here, you have the different programs we have considered, right? Each of them with a separated color. And what I have done is creating this box in which I have grouped all the geographic features presenting the same type. This is, of course, my interpretation, and maybe that some of you might have created additional types of geographic features. That is possible, right? So this is why it's important to do that as generally as a collaborative process with as many representatives from different programs as possible. But what's interesting here is that the highest number of Post-it were concerning health facilities. That's something, of course, we could have anticipated because health facilities are central to the implementation of any program or intervention. This is the reason why we find all the programs being represented here, right? You have Post-it from the different colors of the different programs that have been mentioned, one or different types of health facilities. And in relation to that, it's interesting indeed to mention that most of the participants have mentioned a specific type of facilities, right? While two of them have mentioned the health facility as being the geographic object. And this is a good example of the importance to decide down to which level of detail you need to go to implement your respective program or intervention, right? You might stop at the level of facilities, but most likely you're going to go beyond that and also looking at the different types to be able to implement your specific program or intervention. Okay, so that was the first one in terms of the volume of Post-it that have been provided. The second one, most mentioned type of geographic feature, and this across all programs again, are administrative units, right? So the level, the way the territory is basically this cut according to administrative entities. What's interesting to highlight here, of course, is that the name of administrative units varies from one country to another. Sorry. So in some countries, the first level might be a region, a province, and change in other countries being a state, right? And the same apply for the other levels. But of course, as expected, also administrative units as the second most mentioned type of geographic features. And the third one are settlements. I use the term settlements here, even if all the post-it are referring to the concept of village, because once again, the type of settlement can vary also from one country to another, right? In some country, we'll talk about communities, or even a specific name like in the Philippines here, where we talk about barangays, right? What's interesting, of course, is these three geographic features cover the majority of the post-it, which is what I was anticipating and hoping as a result of this exercise, because these three represent the most core geographic features to the implementation of public health programs in countries. And these are therefore those for which you would prioritize the establishment, maintenance, and regular update of a master list, for example. And those that have completed the HIS Geo-enablement level assessment questionnaire might now understand why these were the three types of geographic features we have included in the questionnaires, because this is what will come across most countries, if not all countries, when we do this kind of exercise. So let's have a look at the other geographic feature types that came out from this exercise, which are having a smaller number of post-its. So first you have features for which I will have anticipated a little bit more post-its, actually, which include laboratories, right? Health personnel, only a few, and mainly mentioning village health workers. There was no mention of doctor or nurses, right? Or midwife, for example. Health areas, mobile services, also a limited number of post-it, and equipment as well, right? I mean, you can also be looking at the managing equipment also from a geographic perspective. You may want to know exactly which piece of equipment that you have the responsibility over find itself, even down to, let's say, even a microscope, for example. So these are also geographic features, right? That for which you can have the need to manage in a geographic way. We even have two features for which I will have at least anticipated one post-it, but there were none, which are patients and vehicles, right? Like ambulances. I think we will certainly have had some post-it there if we will have been having more participants to the exercise. And we have then also something which is interesting is that we have two geographic features that are specific to one program, right? Here we have cross-cutting features, right? Even here, if you look at schools, you have also different colors, health personnel, obviously. But when it comes to vaccination post or foci, in the case of malaria, you have here geographic objects that are specific. But they are really generally very limited because, again, most features are in common across all programs, which actually is a good illustration of the fact that all programs are using the same geography. Once again, this is one of the reasons and benefit of the geo-enablement, right? Is that if we manage to get all the programs to use the same geography, you can then benefit from what geography, geospatial data, and technologies bring to you, and including, thanks to this convergence, the reduction of duplication of efforts, and therefore of expenses that might be linked to this. Now, we have also interesting ones that I did not anticipate to see appearing here. The first one being administrative buildings, and other ones surveillance units. And the last one, which are parts of these other categories here, are wells and landfills, right? But this makes sense, of course, in relation to different context, I mean, perspective on how you look at the health system. And therefore, it's great to have seen that appearing here. We then have two continuous features, right, which are generally indeed being used in relation, for example, to measuring physical accessibility to healthcare, because they have big impact on the easiness for people to move around, right? Land cover and the digital elevation model, so the altitude. And we have a set of post-it, which is also something which is happening in this kind of exercise. We have some post-it which are actually not geographic features. And more programmatic data, right? Like internet connectivity, that's a programmatic data or statistics that you will attach to a particular geographic feature, but that's not a geographic feature on its own, right? Or incidents, this is incidents also, or this one is also an example of statistics or programmatic data that you might have. Yes, and thank you. I see in the chat, yes, cyclone shelters would be another type of, sorry, of geographic features, which we're going to be looking more and more at in relation to climate change, of course, which has become the topic of the decade, if not more. Now, the last thing, very interesting also, a big thank you to the colleague from India, who included also an example of hierarchy, which captures here the administrative hierarchy of the country, right? Which was kind of indicating how all objects, or features are connected to each other, right? They're indicating there is a relationship between them with these arrows. I have just kind of reorganized that in the way we are generally representing these kind of hierarchies, especially when it comes to administrative hierarchies, which is to have that more vertically, right? In this case, and having each of the upper level on top of each other. So thank you again. I'm very pleased that we managed to basically highlight here really all the kind of situations and cases that you might encounter through this kind of exercise. I hope it makes sense to you, the process first and why we are doing this exercise really at the beginning, very early in the overall process, right? To understand this geography, because it's really gonna help make sure you are not forgetting anything from a geographic perspective when you're looking at defining the products, which is the next topic we're gonna be looking into, right? And also it helps to make sure everybody has the same understanding of this geography, right? That everybody calling a community, I mean, speaking about the community, have the same understanding of what they mean by the concept of community, or even health facility. Because at some point, and we'll have examples in further sessions, it's not necessarily everybody that has the same understanding. That has a big impact in micro-planning, for example, as we have seen in different countries. And as you might remember, I gave you some example during module 2 about this kind of challenges that we might face if you are not doing this exercise. So let's come back to the presentation. I just wanted to show you this table, which I have also created on the basis of this exercise, right? And which organize all the different types of geographic features according to the classification that I showed earlier, right? About the type of features. As we can see, most of the features that have been identified can be represented by points in the GIS software. I mean, they could be represented in a different way, but generally they are represented by points because that's definitely the easiest way to do so, right? And what I have done here is also to highlight once again these three main types, right, for which you want to prioritize the establishment, maintenance, regular update, sharing and use of a master list, right? And we come back in about this topic in session 13 in module 4, sorry. Yes, you could also, yes, comment in the chat. Community health workers, health houses can also be added, definitely. That's also a geographic feature that will be represented by a point if ever there is no sensitivity issues, right, into sharing the exact location of the, I don't know, I think you're not talking about the person's house itself, right? But more where the person is providing health services, right? Okay. So this task, so now that actually that closed the presentation of the results, sorry for that. And now that we have a good understanding of the geography of the program or the intervention that you are aiming at geo-enabling, you can look at the geo products that could be generated to address your priorities and or challenges. And as such, support the program of intervention, right, that you are aiming at geo-enabling. So this task or exercise is also part of step B of the geo-enabling process, right? So in the continuity of what we discussed last time, and now we just finished the understanding the geography. So we're now looking at defining the products, right? And these products are being generated in relation to the 5 main applications of geospatial data and technologies we have been looking at since the beginning of this training workshop and which are listed here, right? So for each of these applications, there is products that can be generated. And in some cases, as we will see in a few minutes, the application itself is the product, right? In other case, the application generates different products, right? But in both cases, there is a need to define the following for each of these products, right? You need to really have a good understanding of its purpose, of the audience for which it's been created, so who is going to be looking at it, about its content, and also its format, right? For each of these elements, there is a set of questions to be answered that you have here. And answering them, this question at this stage in the process, once you have the good understanding of the geography, informs the next steps, right? And provides key informations to the persons who will oversee the generation of these products. So we'll now go through the 5 applications of geospatial data and technologies and look at the products that can be generated, example of products that can be generated out of them, and look at what are the purpose, audience, content, and format of these products. Okay. And yes to the answer I'll just put in the chat by one Rosen. What about the ambulatory service stations? Yes, that's also a geographic feature that can be included in the list of the geographic features that are forming the geography of your particular program. So coming back to these products and starting with the first application, which is the georeference master list. And that's one product on its own, right? The master list is the product. And the master list as we started seeing that already in the previous module, because it's key, and we will talk about that even more in details during module 4. This is really a key element to ensure the quality, data quality, right, across the 6 dimensions of data quality, and both for statistical and spatial or geospatial data. It's key to help reducing duplication of efforts and cost, because we are talking about one list instead of multiple actors using their own separated list, and which help to support data interoperability and collaboration. And as such, that provides also the denominator for the implementation of any programs or intervention, right? It tells you if you have to implement your program in 10, 20, 30, 50, or 60 different health facilities, for example, depending on the list. To really fulfill its purpose, all the stakeholders from the health sector are meant to use these master lists, and these across levels, right? So this is really key. Once they are established, they are maintained, they are of quality, everybody should be using them. This is what really will basically ensure really the full potential of this application. And as you might remember from module 1, these master lists form really the starting point for the creation, or should form the starting point for the creation of any information and information products. They therefore play a fundamental, and I will say even foundational, role in the geo-enablement of the health information system or any program or intervention. It's easy to make a map, right? There's a big difference into making sure the map is of good quality, and master lists, georeference master lists play a critical role in this process. So we have looked at purpose and audience for georeference master lists. Now, if we look at content, and those of you might remember that already, I'll repeat that several times in the following modules. What we are looking at a defined set of fields or data elements that should be captured in the master list. We are talking about the data elements that allows to do the following for each record in the list, which is to uniquely identify the record, right? So the health facility, the ambulatory service station, right? The shelter. So talking about a unique identifier, a name, to classify, right? The type or the ownership, to locate. There are different ways to locate, and when it applies to contact, right? Of course, there are different concepts attached to the definition of this content, right? But in general, anything beyond these 4 groups of data elements are, according to us, to be considered as programmatic data or even statistics, and to be stored outside of the master list, because they have also their own proper data life cycle and require specific processes that are different from the content of the master list itself. So when you want to define the content of the master list, I mean, there are different also concepts to go through, and we will do that in detail during session 13 in module 4. I just would like to emphasize today the importance of involving all the stakeholders who will generate, manage, and or use the content of the master list from the beginning of the process. And this through a collaborative approach, right? This is really important, and that requires very often to engage other line ministries than the Ministry of Health, right? Remember the 3 main geographic objects: health facilities, definitely health; administrative units, not health; settlements, not health, right? The curation over the master list of administrative units and settlements is not supposed to be the responsibility of the Ministry of Health, which means the need for the health sector to engage also with the other line ministries who are responsible for this. We'll come back to this during the next module. So this is about the content of georeference master list. Last part is about the format, right? So a master list is typically stored in a spreadsheet, table format, one record per row, one data element per column, right? In the example that you have here above, which is an extract of an L facility master list, each line is an L facility, each column, one of the data elements characterizing each of these facilities, right? So uniquely identify, again, classify, locate, or contact. I mean, here there is no contact for obvious sensitivity issues, but you have example of identify, you have example of classify here, and then you have an example also of locate, right? So 3 of the 4 groups. So ideally, this table is accompanied by what we call a data catalog, which is a summarized version of the data dictionary, which is an extended version of the description of the content of the master list, and also accompanied by the metadata, right? So these 2 elements, we'll come back to this also next time. And what's now also important here is that the way the versions of the master list are being shared, right? Because of course, this is evolving through time, right? You're gonna have a version for this year or even this month, this semester, or this quarter, right? So your master list, especially when it comes to things like L facilities or even faster for settlements, there will be a lot of changes through time. So you will have different version of your master list. So the way you're going to be sharing these versions as standalone spreadsheets file, right, depends on the internet connectivity, actually, right? So if the internet connectivity is low, the version of the master list can be shared as a standalone spreadsheet, right? As an Excel format, for example, because we want to have multiple worksheets to be able to store not only the list, but also the data catalog and metadata. So a CSV file, for example, is not necessarily appropriate in this case. You cannot have more than worksheet, right? And if the internet connectivity is good, that's where you could be using an IT solution serving as a registry or a command geo registry to not only share, but also store, manage, etc. And this is something we will come back, this whole concept of registry and command geo registry. We'll come back to this in session 19 in module 5. So module 4 will focus on data. Module 5 will focus more on technology, right? But what's important here is that in any case, you should ideally host, manage, and regularly update those master lists, either in a registry or a command geo registry, to be able to keep the changes over time in such a way that you can use that for conducting trend analysis, for example. So this covers the purpose, audience, content, and format for the first application of geospatial data and technologies. The second one, the second main application is population estimation and spatial distribution. So this one generates products. It's not a product on its own, right? And so there are 3 main purposes for the products that are being generated through this application, which are to first provide highly accurate and as accurate, as disaggregated as possible information regarding the size and the location of the target population, right, that you are considering for your respective program or intervention, right? The second big purpose is to be able to estimate the same thing in remote areas for displaced or marginalized communities, or I will say even areas where it's not possible for data collectors to go right in the field. So that's also an approach which is being used there. So that's one of the purposes of using this application and the product that will be generated. The third one is to capture population changes over time. So the possibility of doing modeling and prediction of population in the future. So what is generated here can either serve as data input for another application or be the final product on its own, right? You have here 5 examples of these different type of purpose you can reach. So the first 3 example here relates to population estimate and location being used as an input for a further analysis, right? Like geographic accessibility, for weighting and normalizing certain values, right? Including to serve as population denominator. The last 2 are final products, right? That can be directly used for planning or decision making. So we're talking about maps presenting the spatial distribution of population, including disaggregated by age and sex, or tables which are summarizing or helping to visualize population distribution in a tabular format. The audience here, again, for the products that can be generated are, of course, any programs or interventions, because population size and location is key to the effective delivery of any program or intervention, right? So again, a very large audience for the products that are generated. When it comes to content and format, that the products being generated can take, this will of course depend on the purpose. We can nevertheless group these according to the 3 types listed here. First of all are geospatial data, so GIS layers, right? Containing the spatial distribution of the target population. The second one are tables, like I was mentioning earlier, which can, for example, present population according to different level of disaggregation. Here you have some examples in between brackets. And of course, graphs and charts based on the tabular information that has been generated, and these to facilitate visualization or analysis, like a trend analysis, for example. We have a question in the chat. Please don't hesitate to use the Q&A for the questions. It's easier for us to capture, to track. I can see this one. What is the frequency of updating catchment area population? Well, that will depend very much on the program and the intervention, right? That is what will define the frequency at which you need to update this population. That's the first thing. Of course, after that, there is a question of the resources that are available to be able. So the first one will define the ideal frequency, right, for update. After that, you're going to have to look at the context to see if it is really possible to do that from a resource perspective. But this is where it becomes really, again, interesting for looking at not only basically implementing the geo-enablement within the health, among programs within the Ministry of Health, but really involving also the other governmental entities that are in charge of the data that you need for the implementation of your programs, right? And population is a good example of this. We'll come back to that in module 4. So ideal frequency versus what is realistically possible based on what is already available and what are the resources and the mechanism in place to be able to do that. Now let's go back to the kind of Okay, we have something interesting happening here. Okay, up. Sorry, I did not realize we're jumping to the next applications already. I have to switch between the slides and the chat. Sorry for that. So we already reached the third application of geospatial data and technologies, which deals with geographic accessibility and service localization. So the purpose here also a bit broader, right? And there is a lot of different products also that can be generated under this specific application. So the main purpose of those products are to assess the population coverage of currently existing health service delivery network, right? This is what is generally referred as accessibility analysis. Second purpose is to optimize the spatial distribution of existing or planned resources, right? Where can you better locate personnel or equipment or even facilities in order to improve population coverage? And the fourth one is to estimate the time of referral between different levels of the health service delivery network. So this is really looking at, and I should have put the subtitle here, the geographic accessibility part of this particular application. We look at the service localization after, right? So these are the main purpose of the geographic accessibility part. And once again, the audience is very broad in public health because effective and equitable access to health services is key to any program, right? So any program that is looking into basically one of these purposes will be the audience for this kind of the product that can be generated through this application. So when it comes to content and format, again, for geographic accessibility, we have here a few examples, right? Starting with what we call really purely a geographic accessibility analysis. So this kind of analysis can generate several different products, 5 that you have here. First of all, geospatial data, some GIS layers that contain the spatial distribution of the travel time to the nearest point of service delivery, right? And these for different scenarios, transportation scenarios. Here you have 2 examples, either walking plus using a motorized vehicle when reaching the road network or purely walking. Now, if you use these travel time layer, they can be used to derive modeled catchment areas and proximity basins, right? So this is the second type of product that you can obtain, which are also useful for different programs. And then you can combine also these layers with the spatial distribution of the population, right? Which is what you will obtain from the previous application of geospatial data and technologies. As well, you combine that with population and the geographic extent or boundaries of specific areas of interest, like administrative units, health areas, proximity basin, etc. And that can allows you to obtain this estimated population coverage for different travel time within each of these areas, right? So you have an example here of the population coverage for different regions in the Philippines within 1, 2, 3, or 4 hours travel time to the considered type of services. Okay, you can then use this tabular information to generate maps again, right? You can create thematic maps, which will spatially represent the result you obtain in this tabular form. And you can also do, of course, graph that will, for example, help visualizing the spatial distribution of population coverage for different travel time right? Or depending on different scenarios, for example. Just here, question in the chat, or population change of the future is estimated. So there are also different methods being used to project, right, population in the future. That could be the topic of a module on its own. And actually, as part of the previous application of geospatial data and technology, that's also something where GIS can help to some extent, right? First, in order to make sure that there is a good understanding of the spatial distribution of the population, but then also potentially also estimating how the built-up areas could be evolving through time, and therefore where we can expect to have a population being growing more faster than in other areas. So there are some other, there's many things existing in there. It's a whole topic on its own. Coming back to our geographic accessibility, in terms of another types of analysis that can be conducted, sorry, which here is the referral analysis, so measuring what is the travel time that, or even and distance, right, between different levels of the health facility, the health service delivery network. So the product that you can obtain here are tables, first of all, right, that will contain the travel time, sorry, and distance between the different levels of this network. Or you can also represent this result under the form of maps that will show the spatial distribution of travel time between different types of health facilities. Here, what you have is an example of a project in Nigeria showing the referral travel time between basic and comprehensive emergency obstetric care facilities, right? And what we can see is that the travel time between BMOC and CMOC is above 2 hours in the southern part of the state. And the result of this analysis actually led to the program deciding to add one more CMOC in the southern part of the state to address basically this gap. So that's an example of content and format of for referral analysis. Another one for optimization. This is this time obtained when performing the optimization of health services in the southern part of the Philippines. And this exercise has been conducted for a specific intervention, which is the delivery of what is called the maternity care package, MCP. And this leads to an increase in population coverage of 5.6, I think 5.6%. And this was done by stopping the provision of this package in around 19 health facilities, starting the package in another 19 health facilities that were in areas where coverage was low, and also increasing the coverage capacity of 26 facilities to be able to cover the anticipated demand, right? So analysis presented here under the result of the analysis presented under the form of a map, right? Showing the modifications that have been operated through the exercise, as well as under the form of a table that shows at the province level the change in population coverage obtained through the optimization. You have these, both reports are part of the Google Drive. You have also the link to the report below if you're interested. Some last set examples in relation to another kind of analysis that can be conducted in relation to geographic accessibility. So as you can see, for this particular application, there is a lot of potential product that can be generated for different kind of analysis, always maps and tables, right? But really different type of information that is being provided. So here, in terms of scaling up, for Laos, PDR, and Vanuatu here. So on the left, what we have is tables and maps that are showing the difference at the subnational level in terms of population coverage obtained by testing different scenarios, right? So this was, again, in relation to emergency obstetric care and trying to see which scenario could be leading to the best population coverage in terms of access to this type of care. And also on the right, here you have an example for Vanuatu in terms of scaling up really purely by adding one or two additional dispensaries in some part of the countries and the impact this addition is having on the population coverage. So on top, you have this presented in a tabular form. What you have here also at the bottoms are maps showing the spatial extent of the catchment areas corresponding to the addition of this health facility. And by the way, just so that you don't think that this is kind of like a funny thing here, this is because the accessibility analysis in the case of Vanuatu was taking into account the movement by boat, right? So just to mention that this kind of analysis can be applied in really all the contexts depending on the availability, accessibility, and quality of the data. So this was for geographic accessibility. Now we can switch to route optimization, right? And in this case, the purpose is different than for geographic accessibility, but it's either to identify the most effective route for the delivery of commodities or services, and also where to place certain resources along these routes, right, to support the effective delivery of these commodities or services. The audience in this case are all the programs willing, again, to identify these routes and all the optimization of resources along them. These products are generated mainly under, once again, under the form of maps or tables, right? Maps allowing to visualize the most effective routes that the model has come up with, and tables that will be listing each of the stops along those routes and providing information about them, such as the name of the place, right? The geographic coordinates, the travel time between each stop, etc., etc. One question: what services are you using for route optimization? I guess you mean type of software or more than services, right? Okay, thanks. Well, we'll talk about technology during module 5. There are different tools these are things you can do either in certain off-the-shelf GIS software. You have also applications that have been developed specifically for this, including outside of the health sector. As you can guess, this is things that is being done a lot for all the logistics, right? The delivery of parcels, etc. So there are different type of applications, IT solutions that can be used for doing this kind of work. Let's move to the fourth one and most used application of geospatial data and technologies, which is, of course, thematic mapping. So thematic maps are information products having for purpose, of course, obviously to visualize or convey information or message about a specific topic or theme, right? It's a powerful type of product which explain their popularity, as well as the reason for seeing them being used in almost all the other application of geospatial data and technologies, right? So there's a very broad audience, of course, once again, for this kind of products. In terms of content, we are talking mainly about geospatial data and statistical data that are combined together, as well as information useful for the user to read and understand the map, right? All of these being organized ideally according to what we a predefined template. We'll talk about this a bit in other modules. That's the topic. I mean, creating thematic maps on its own is also a topic that could cover one full module. We'll point to some resources, including the guide that you have here that describe the whole process on how to generate them. There is also training material available on how to create good thematic maps that we will mention to you during module 5, I think. Yes. Okay. When it comes to format, of course, different options. I guess you're all aware about these depending on the purpose and the audience. 3 main ones: printed maps, right? Paper maps, necessary when there is no device or internet to look at them, an electronic version. Digital version of the map, mostly in PDF format, so you can really keep the highest level of detail, right? To zoom in and zoom out. And last but not least, also, of course, web-based, which allows for the map not only to be in a digital format, but also to be dynamic, right? So it provides access to different functionalities, and this either as a standalone map or as a component of a dashboard. So this is a growing, of course, format, I would say, sorry, of thematic maps, especially when it comes to dashboard. One last slide on this application to highlight that many different thematic maps can be generated for a specific type of intervention, right? So you have an example here for micro-planning, for which you can see that different maps with a specific purpose, content, and audience can be generated at each phase of the micro-planning process, right? So for one specific intervention, you might end up generating several different maps, having all of them, again, different purpose, different content, and not necessarily the same audience. Okay, and we reach finally the 5th. So you see, there's a lot of things you can produce, products that you can generate through the application. I mean, the 5 application of geospatial data and technologies. So last application is all you can do with global navigation satellite system, right? Including navigation, tracking, as well as the collection of geographic coordinates in the fields. There is a specific, of course, purpose, audience, content, and format for the products that you generally generate for each of them. I'm not going to go into too much detail. I guess all of you have used at least once one of your smartphone or other device you might have in the car for navigation. Tracking, of course, is a different application to kind of make sure that you can see where on real time your different assets like vehicle are located, or identifying gaps in service delivery, right? It has been used quite a lot in the context of vaccination. Audience, very large. Contents are the geographic coordinates that are captured at a given frequency. So you have that under the form of maps. Dynamic maps very often, so you can track. If some of you have been following things like sailing race, you know, you have also these visuals where you can see where the boats are located at a given point in time. So this is also kind of an application of tracking. And then the collection of geographic coordinates in the field. Of course, anytime you need to locate something accurately, you will have access to this, and generally the final product is a table containing the coordinates that have been collected, hopefully following a specific SOP. We'll come back to that in module 4. Okay, we are a little bit behind schedule. I was hoping to finish at the hour with this session. Let's maybe just have a 5-minute break and come back at past 15 to the hour. to continue with the next session for today. Okay, so talk to you all again in 5 minutes. Thank you. Thank you, Alexandre. Welcome back to session 9 of the training workshop, which is the third session of today's module. So during this session, we will talk about the identification of the equipment, so in terms of hardware and software, and also technical expertise needed to generate the products that have been defined during the previous steps we covered before the break. So such task is the last one included in step B of the overall framework implementation process. Right, so we are still here. It's the last part of the step B. And the first important thing, no way, this thing is, just 1 second. Go up. The last important thing to recognize is that decisions on acquiring specific equipment, hardware and software will depend on the products to be generated, right? And also indirectly on the data to be collected or generated. And this decision will be influenced by the context and the availability of financial resources. So let's have a look at the type of hardware you might be needing and the content, actually the information that I will show you in these slides, and the following ones are being extracted and adapted from the Geo-enabling microplanning handbook, which is also a document you will find in the Google Drive. So in terms of hardware, like for any other applications, right, that will require the use of a computer, you're obviously going to need a laptop or a desktop computer with a monitor. By experience, ideally, you will want to have a large size monitor or a dual monitor setup. For having worked in this field for 25 years, I can guarantee you that this makes a huge difference when you are working on maps and several different things at the same time. The next key equipment on the list is definitely also an external drive, right? Or possibility to have a backup system in place. And this is really a must. I personally even perform a weekly double backup of my computer's content. You really don't want to lose weeks or months of the work you have done on data, on creating maps, and even more importantly, also the projects you have generated in your GIS software to combine color and everything. So you want to make sure you have this being backed up. An online workspace is also needed if you are to work collaboratively on the development of the applications of the geospatial data technology. But this is also, of course, useful as an additional backup. It is important here to make the distinction between workspaces where you can store documents, right, and on which to work collaboratively, but from which you must download geospatial data to be able to use it in a GIS software in case you use it to store that data. This is, for example, the case of a Google Drive, right? You cannot directly open geospatial data that you have stored in your Google Drive. But there are also other workspaces where you can store your geospatial data and from which you can directly use it in a GIS software, right? And Dropbox is one example of this kind of workspace without trying to make any promotion of a particular solution. Internet is, of course, needed. Internet connection, not only to access the workspace, but also other online resources or applications, including online GIS applications, as well as web-based maps, web maps or base maps, right? Like satellite imagery that you would not store on your own computer. If you need to print maps, you will either need a printer, and or a plotter, depending on the size of the maps and other GIS-based product you need to print. Until now, of course, these are all very generic equipment, right? Again, which could be used for other type of application, not only the use of geospatial data and technologies. The last piece of equipment is itself very specific to the management and use of this kind of data and technology. I'm referring, of course, to device able to receive signals from global navigation satellite systems to navigate, track, or collect geographic coordinates in the field, right? The fifth application of geospatial data and technologies we looked at before the break. The following table and annex, which are from the Geo-enabling microplanning handbook, are interesting and provide some additional useful information regarding these different pieces of equipment, hardware in this case. The table indicates for which applications of geospatial data and technology the different pieces of hardware are actually needed. The annex does itself provide technical specification for each of these hardware. If we now look at software, there's also quite a large panel of software available and that can be used depending on the needs. Only the main types are mentioned here. As a matter of fact, I mean, it's important to mention that the technology is really not an issue nowadays. The possibility offered by the technologies in that particular field are already endless, and which is sometimes or often, I would say, misleading. We'll come back to this during module 5. What is really more critical are really issues related to content, and the reason why we dedicate a complete module to this, module 4, right? And the technical expertise, we'll come back to that at the next set of slides. And of course, also all the supporting environment to ensure long-term sustainability, which is what we will look at in module 6 as part of the geo-enablement of the whole health information system. But in the meantime, coming back to software, it's important to make the distinction between desktop GIS software, online GIS software, and online mapping tools, right? The first one, desktop GIS, offers the largest panel of functionalities in a desktop environment, right? And QGIS, ArcMap, and ArcGIS Pro are examples of this type of GIS solutions, GIS software. The second one, online GIS, are reproducing most of what you get in a desktop software, but in an online environment. This is what you get with, sorry for that. This is what you get with ArcGIS Online or GeoNode as an open source solution. And the third one, which is limited mainly to providing online thematic mapping capabilities, right? So the online mapping tools and Google Map is an example of these kinds of tools, right? So 3 different types of GIS, so-called GIS tools, but that have a different purpose and also capabilities, I would say. We then need to mention that the use of specific functionalities or tools, right, requires sometimes the use of what we call GIS extensions, right? So which are not coming are not included in the GIS software as such. So that's you need to install them or to plug them to your desktop software to provide you with these functionalities and tools. And that's the case for both QGIS ArcMap or ArcGIS Pro. You have these existing extensions, different type of extension, this being said. Now we have two types of IT solutions, which I mentioned already earlier in relation to the management of master list, and IT solutions which are getting more and more attention and are needed to ensure for the hosting management update and sharing of the master list with the associated geospatial data in the case of a common georegistry. And these are tools we will cover in more detail in module 5, because these are specific new kind of technologies. Then you have all the field data collection apps, right, to collect data in the field, starting with geographic coordinates, of course, if the device is equipped with the necessary receiver to connect with the global navigation satellite systems, right? And last but not least, spreadsheet software like Excel, which are key for the preparation of the statistical program or programmatic data to appear on thematic maps, or being used also in other applications, right? When you're dealing with geospatial data and technologies, you are managing tabular data anyway. So like for the hardware, earlier, the Geo-enabling microplanning handbook contains a table indicating for which applications of geospatial data and technologies each software is needed, right? And the annex provide once again the technical specification for each piece of software. One important note before switching to the next topic is to remember that even if you might do the identification of most of your equipment at this time in the process, it can always be that additional needs for equipment will appear at a later stage, right? As you go into specifically dealing with the data, or you start discussing in more detail on some specific aspect on for example, the storage or the sharing of the final products, for example. Okay, so this is what I wanted to share from an hardware and software perspective. We can now switch to topic, as I mentioned earlier, which is key, of course, which is the question of the skills and expertise needed to geo-enable the health information system, a program or intervention, including, of course, the generation of the products that have been identified. So it's important also to identify these skills and expertise as early as possible in the process. That's why it's happening now as part of step B, to have sufficient time to identify and, if needed, hire the staff in question, right? You don't want to kind of finding yourself where your whole process is being slowed down because you have to spend the time to find the right person that matches the skills and expertise that is needed. So what you have here listed are actually two types of profiles that are needed in this context. The first one is really at the level of overseeing the overall process, right? And we're talking about at least one individual that will oversee the implementation of applications, support the use of the equipment, the development or the contextualization of guidelines and SOPs, as well as train people. So this will be the person that is the most knowledgeable about the overall process, about the method, about the software, etc. And then you have technical staff to directly support the in-country work, including the use of this equipment, right, to generate product, to manage the data, to potentially go collect the data in the field, conduct the analysis, apply spatially distributed models, generate thematic maps, right? It's also important not to forget about those who will be using the resulting products, and they might also need to get some training or acquire some skills to really be in the position to understand and interpret the content of this product, right? So these people are not people you will hire. I mean, they're already in place. That's generally the managers that will be using or having requested the product in the first place. But you might have to ensure that they have some understanding on how to read basically the product that have been generated. One more useful table from the Geo-enabling microplanning handbook, a table that provides an indication of the level of expertise that is anticipated across the different technical skills mentioned in the previous slides. And it's not only at the central, but at the subnational level. And this across also 4 of the 5 applications of geospatial data and technologies. So this is something that is useful for you to kind of look at the type of expertise you might be, level of expertise you might be looking at, depending on, again, the level, the type of the level in the structure of the system, the different applications, right? And the kind of skills that could be needed. The microplanning handbook does also contain an example of generic terms of reference for the person overseeing the geo-enablement, and UNICEF's guidance on the use of geospatial data and technologies in the immunization program does itself contain a generic term of reference for the technicians to support the implementation of the in-country technical work, right? So these are also very useful tools in a way to help identifying the type of person you might either already have or might need to hire in order to support the process. Okay, so that was a short session. So that brings us to the end of it. In terms of equipment and skills, I see that I don't have any questions to answer. So we'll switch directly to session 10, which is the session during which we will look at how you assess the current level of geo-enablement of the health information system program or intervention. So to summarize, until now, the implementation of the process has allowed us to identify, right, the current priorities, challenges, needs, and gaps, right? So that was step A. It allowed to define if geospatial data and technology can help address at least some of those priorities, challenges, needs, and gaps, right? If this is the case, then you reach step B. And during step B, during step B, you understand the geography of your program or intervention. You define the GIS-based products to be generated to address the priorities, challenges, and needs. And you identify the needs in terms of equipment, technical expertise to be able to generate these products, right? So now that all of this is done, it's time to have the most comprehensive picture possible in terms of the management and use of geospatial data and technologies in the health sector. And this picture is obtained through the assessment of the geo-enablement level of the health information system. So this assessment should ideally be performed at the level of the HIS, even if what you are aiming at is geo-enabling a particular program or an intervention. And this is because some of the elements of the framework are cross-cutting, right? Especially the first stage in the pyramid, right? Remember, these are things you want to institutionalize across all the programs. And that's why it's important to do this really at that level. So such an assessment is critical for the rest of the process, right? As the action plan to fill the gaps will be based on the result of this assessment. So it's really important to put as much care as possible on this assessment, especially if it is conducted for the first time. It's during this exercise that potential gaps are identified using the benchmark that have been defined for each of the 9 elements of the HIS geo-enabling framework, right? You can find this benchmark in the HIS geo-enabling toolkit, which is also something for which you have the copy in the Google Drive. So this benchmark is really the foundational part of the assessment. You can conduct the assessment in different ways, right, depending on the context and the resources that are available. There are 3 main ways we prefer, we are promoting. The first one is self-assessment by MOH entities. In this case, it is recommended for a workshop to take place. Anyway, after that, to validate the result of the assessment. We'll show you some examples justifying this during the next session. This is also the approach that has been followed for the workshop in Senegal last November, for example. The second approach consists of having an external party conducting one-on-one interviews with each core MOH program unit. The advantage of this approach compared to the previous one is that interviewer can clarify the questions and also directly address potential inconsistencies, right, between the answers being received. This being said, this approach might still require some cross-validation to take place, especially for questions that are covering cross-cutting elements of the framework, like governance or policies. I will also show you some example later. The last one, which is the one I personally prefer, consists in conducting the assessment during a workshop, as long as the group, as long as this workshop can group all the concerned program and unit, right? So you can have everybody in the room. The advantage here is that you can directly clarify the questions with everybody and also do the cross-validation of the answers on site. So you really gain time. The other advantage is also allows to collect additional insights and material during the workshop, right? So like reference documents that people might be aware of, so that can be easily identified about this. Okay. As mentioned earlier, you want to have as many program units as possible being involved in the assessment, right? Especially those that directly relate to the current public health priorities. At the minimum, you want to ensure that those listed here are involved because they represent the main potential users. And I could even say benefiters from geospatial data and technologies, as mentioned during the first module. So we are talking about the HIS unit. We're talking about the unit in charge of planning, even if planning is an activity that can be done in different programs, communicable disease, immunization, and emergency management. Right? You can, of course, involve more. The more, the merrier, right? But at least if you have those here, you should capture most probably most of the current use of this kind of data and technology in the health system. What's important to mention is that conducting the assessment provide also an opportunity to share recent development in the field of geospatial data and technologies and demonstrate the potential that these data technologies provide to support public health programs, right? So this is kind of a soft way to engage people into different programs intervention in the development of the action plan, for example. So to help this process, we have developed this quick geo-enablement level assessment questionnaire that some of you have completed. That we use that generally as the starting point of the overall assessment. This questionnaire contains 11 questions that are organized according to the 9 elements of the HIS geo-enabling framework. It's good if you implement the questionnaire before any kind of workshops, right, or activities linked to the geo-enablement, because it helps, again, to introduce the terminology, the concept behind the geo-enablement of the HIS. And this is important because it contributes to make sure everybody have the same understanding of this concept, right? We'll talk about this again in module 4. Now, once you conduct this, you apply this questionnaire, the answers are organized, analyzed, and captured in different form, including the colored pyramid you have here, or in a report, right? I mean, we pass from the questionnaire to a tabular form, obviously. We can have also, and I'll show you some example of a way of organizing this to facilitate the next step of the process. This is more kind of a summarized view of the result of the assessment. All of them have their usefulness, as we will be talking about. So those who have completed the questionnaire know that the first 2 questions are actually looking at the priorities and challenges faced by each program or unit that fill the questionnaire, right? So these 2 questions are supporting step A, actually, right, of the process, and could therefore be used at that time. You can also very much decide to conduct the full questionnaire as part of step A, right? So as the entry point for the overall process, you conduct the assessment using the questionnaire. You only use the first 2 questions at step A, and then when you reach step 1, which is the assessment of the current level of geo-enablement, then you use the answer to the rest of the questionnaire. I know I will maybe sound biased, but this will never be a loss of time to do that, right? Because geography is an important dimension to any program or intervention, and you will therefore always end up identifying at least one application of geospatial data or technologies to support your program or intervention. So if you do the whole assessment at first, you will anyway use the rest of the questionnaire when you reach step 1, because you will definitely reach there. Okay. Now, as per what is being described in the HIS Geo-enabling toolkit, the questionnaire is on one piece, right, of the overall assessment. There are additional information and documents to be collected across the 9 elements of the framework, and this to complete the picture of the situation, right? These information and documents include strategies, existing strategies, policies, data specification, documented use case, etc. In addition to providing additional key background information, this exercise might also help identifying additional entities or programs to be involved in the process, right? You might have said, okay, we start with these 5 programs, and then as you ask the questions, you find out that you get this material, you find out that there's actually maybe another program that has been using this kind of technology to kind of support their intervention. Okay, we have a recommendation there. Will it be recommended, practical, to engage with stakeholders prior to sending the survey to encourage engagement in completing the survey? Yes, you can also definitely do that. possibly by holding a remote workshop to complete it together online. You could also do this. We never had the opportunity to do that. We always basically find ourselves in a way where we are invited to come and facilitate the beginning of the process, and we always found useful to basically initiate the questionnaire before we come, even if it's not fully completed or not fully understood, but it really helped to kind of, as part of the engagement, basically, to kind of get them to think about this and come with more questions than if we would have done that directly during the first workshop itself. But if you have the possibility to implement the overall process with local implementers, local support, why not? You could definitely do that. And that could be certainly working. I've never tried particular myself. Thanks. So I just want to finish this session by showing again this slide, which I presented during module 1, because this is a very good and concrete illustration of just the answer actually I gave. A good illustration of the implementation of the assessment, how the results have been used to develop country-specific action plan. So in this case, like I just mentioned earlier, we are having this workshop, 11 countries. So that's the thing. When you also have multiple countries, it's difficult to have this remote, on-site workshop, right? If you do that at the level of one country, that's possible. You engage and you do at the same time. Here we were having 11 countries coming together at some point in time in November. And so we really had this pre-workshop survey, which is the questionnaire, right? We just talk about, we send that to them, we ask them to fill the questionnaire, and we had a first analysis of these presented to them at the beginning of the workshop. And then we use the workshop to make them understand each of the components of the framework. And as their understanding of the framework was increasing, they were then able to either complete or adjust or align their answer to the all the elements of the framework. And then you will see that that has really had a big impact compared to the online approach. You see the result for Asia Pacific in a short while. And then because we had this complete picture, then it was possible after the workshop to help most of these countries develop an action plan on the basis of the result from the questionnaire and the discussion during the workshop. So for me, this is kind of the best model in the case of a multiple country type of event. Now, on a country-specific approach, I will also do the same thing. And we are doing this now for Cambodia. So before the first series of workshops, we have invited the different programs to fill the questionnaire, and we'll present the result during the first session at the beginning of the week. But again, I'm sure this could be also working in the approach we discussed earlier. Okay, last slide for this session, just to mention that normally when you are, not normally, when you are geo-enabling a program or an intervention, there is one additional task to perform as part of step 1, which you don't perform when it comes to the health information system, which is to assess the availability, accessibility, and quality of all the other data that is needed to generate the products that have been defined during step B, right? This is a very critical task, which has its own process, right? Which is captured in the geospatial data management cycle, and the reason why we have dedicated the full module 4 to it. So we'll come back to this on August 14, right? So in the meantime, let me present to you the result of the second part of the HIS geo-enablement level assessment for Asia Pacific. Second part that deal with the evaluation of the situation across the 9 elements of the HIS geo-enabling framework. So as I was mentioning earlier, 11 questions are in the questionnaire to cover these 9 elements. We use these questions, the answer as the baseline for developing action plan to fill the identified gaps. And again, as I mentioned, is also ideally implemented across as many programs as possible to get really the most comprehensive picture possible. So when you implement these in a group of countries, what you expect to get is the example again from the last November workshop, right, with the 11 African French-speaking countries. That's the summary table, but you can see the whole table is complete. We have one color per cell indicating where the country stands for the 9 elements, and this across different programs and units. In this case, we also had the HIS unit as well as the malaria, TB, and HIV/AIDS elimination program. So this is really, when you have something like this, you can really analyze, and you can see that really on top, right, when it comes to use case, there are either completed use cases or in the process of being implemented through projects supported by different partners. But these use cases have not been institutionalized in the sense that you have really important gaps, especially when it comes to the institutional framework, while financial resources are missing for all these programs, policies are not there, governance mechanisms most of the time are not there, or in the process of being established. There's not even a vision, a strategy, or a plan when it comes to the management and use of geospatial data and technologies. So in other terms, the programs in these countries have not yet reached the level of geo-enablement that will allow them to define, implement, and sustain their own project based on data of quality, right? So that's really the baseline that we can use to develop this plan. So let's have a look at the result obtained for Asia Pacific. First, some information about the participants to the survey. Thanks to those who are attending today and completing the survey. So we had 40 individuals from 16 countries, representing a total of 30 different programs. The biggest contribution was coming from the National Malaria Program, because that's a survey we started before also this training workshop as part of the Asia Pacific Malaria Elimination Network, all right? We have a few countries that have been very active, like Papua New Guinea, Timor-Leste, and Pakistan, which have really contributed a lot to this. Thank you very much for this. And as you will see, there's a benefit coming out of this. So here is the resulting table. And the first thing we can notice, of course, is that there's a lot of cells with no answer. There's a lot of gray in this table, right? Which illustrate, again, the importance of the workshop to complete the assessment by having, the answer from all the key programs. So definitely at some point in the process, at the beginning, in the middle, to get everybody in the room and go through all of these is really key. Doing it virtually only might not get the full coverage. We have one more unit here one more program compared to the exercise in Africa, which is the EPI unit. Right? There were also a few countries where there were additional units. I did not include them here, simply just to facilitate the comparison between the countries. But it's interesting to look at the cross-cutting elements. Right. So first of all, when it comes to the master list, right, and the geospatial data, so we really see that there is, things are happening, but it's not sufficient, right? There are gaps across all the countries that answer. Same thing when it comes to the concept of registry, right? Apart from Malaysia, we indicated having a common geo-registry or a set of registries. All the others either doesn't have a registry or are still in the process of developing this. There's a general absence, again, of governance mechanism. Same thing, big gaps in terms of policies, right? So in terms of the cross-cutting elements, there is really a big gap like we observe for the African countries. For the other elements of the framework, we can have a look at the National Malaria Program. This is the programs for which we have the highest coverage across the 16 countries at this stage. what we can observe is that there are use cases in malaria, right? In several countries, they have documented use cases, or the use cases are undergoing, so there are projects happening. There are significant gap in terms of technical capacity, not sufficient technical capacity, right, to support their activities. Geospatial technologies, again, apart from Malaysia, gaps there as well. And good number of national malaria programs have developed, it's interesting, have developed their vision, strategy, and plan when it comes to geospatial data and technologies, but from the perspective of the financial resources, apart from Timor-Leste, but I think this needs to be validated because that's the only one, having mentioned that they have sufficient resources. All of the other countries are indicating that this is not sufficient. So that's already a preliminary result. We hope we're going to be able to complete this as the time is passing, hopefully as part of additional activities. If you're interested to continue answering, that's a message to the Ministry of Health representative on the calls and partners in countries in Asia Pacific. If you are interested to contribute, the survey questionnaire is going to remain open, so don't hesitate to enter your question in there. Now, what is important to mention is that, I mean, this table is only one of the products we generate out of the implementation of the questionnaire, right? What we also do is generate a country-specific spreadsheet in which we have one worksheet per element of the framework, right? And then each worksheet contains information about the element and also the answer from each program captured in the visual way, right? So malaria program, for example, when it comes to geospatial technologies, indicated that the program has some geospatial technologies, but they are not sufficient to implement its activity. So that allows to have a direct visual representation of the answer by elements in the form of a spreadsheet. And that's what we use as a reference. This spreadsheet is what we use as a reference for developing the action plan. What we can see already here is that sometimes there is not even some agreement among members of the same program, right? Let me give you two more examples. I can mention which country it is, but the first one is in relation to vision, strategy, and plan. And as you can see, the answer where one program, I mean, that's a district level entity, doesn't know where the MOH stands. But when it comes to all the program, different programs think that the Ministry of Health finds itself in different place into this continuum, right? So this is also a good opportunity to ensure that all of programs have the same understanding of the different elements and also discuss among themselves to reach a consensus regarding the situation currently observed in the country. Another example at the use case level, where for one program, there is different understanding about where the program finds itself in terms of the availability of documented use case. So there's some work that needs to be done. But again, it highlights the importance of not only depending on the self-assessment, right, but really having additional consultation, or ideally a workshop to complete this. Which brings us to another reason for conducting this exercise, as you might remember, and which is to identify which countries from Asia Pacific will be receiving the support from APMEN to develop an action plan aiming at filling the gaps observed during the assessment. So we have considered the 16 countries for which at least one program completed the questionnaire. And then we have been using the following criteria to obtain a kind of a ranking. We have looked at the number of programs having completed the questionnaire, because we want to make sure we have the most comprehensive picture possible, right, to be able to start the assessment. We then have considered how many MOH participants attended the first and the second module, this training workshop, because also that demonstrate willingness to be involved as well as an introduction to the concept. And we also added one more point in case we have local partners for them from that country that was attending at least one of the first two modules. And so that gives us this specific ranking, out of which we have pre-selected, if I may say, the 6 countries. And now what we will be doing, because we need to go down to a maximum of 3 countries, we will be contacting those who have contributing to the survey and or attended the training workshop, MOH as well as local partner, to find out if they are interested in receiving the support and also ready to be actively involved in the exercise, right? We need to make sure that all key programs are engaged, that we can complete the assessment and solve potential inconsistencies and also develop the action plan. So we're going to be doing that in the coming weeks, hoping to be able to announce the final result of the selected countries, up to 3, during the 4th module of the training, which will be on August 14. Okay, let me see if there is anything. Okay, yeah, thank you for the input, Leila, in the chat about Google Map. Yes, I will just one caveat in terms of using Google Map to do this kind of analysis is that, first of all, it depends on, I mean, hospital, there is a higher probability that the hospital is in the right place. There are all the lower level in the health system are not necessarily located in the right place in Google Map. This is something that's going to work for specific scenarios, right? But that's, I will say, a good example to demonstrate the potential of using specific IT solutions to address the question of geographic accessibility to healthcare. Okay, we are just at the hour, a little bit more, 2 minutes. Please give me 1 more minute to show you the schedule for next time. And just mention once again that this next module will be focusing on content, right? We'll be looking at the geospatial data management cycle, of question of availability, quality, and accessibility of data, which is really core, and I will say one of the most important elements in the overall discussion. I just need to thank you for your attention and wish you all the best until the next module. See you again soon. Bye-bye.